This video, I'm going to talk about therapists planting satanic cult memories in women, some NIDA publications that prove my point. Now, not only is the effects of marijuana can be mistaken with abstinences, okay, they space out, we lose track of time, daydreaming can as well. So can alcohol, so can other drugs as well as prescription drugs. Now, let us look at this. Therapists planted satanic memories in women. Now, a psychologist accused of hypnotizing a woman into believing she possessed multiple personalities and participated in satanic rituals. Now, why would they do that? So they can force her to take powerful drugs that will give her a real problem. And the guy probably had a sexual obsession with her. We don't know. I'm not going to go there and say that, but it opens the door to that. Say, I have an obsession with this patient, so I'm going to convince them that they have a problem they don't have and suck them dry of money, or just so he can be around them like a sick bastard. Now let's go to the next article. That talks about how the therapist Mark Schwartz, okay, he carelessly and neglectedly hypnotized her, and she was under the influence of various psychotropic medications to treat depression and anxiety. Okay, so what are they doing? Now let's go to the next article. What is this one talking about? Some teens report non-medical use of prescriptions develop disorders. You mean the same thing I've been saying this whole fucking time? I've been saying for 22 fucking years. Since I was 8 years old. Talking about, Mommy, Daddy, why do psychiatrists lie to people and give them pills to control what they do? Why were my friends normal before they start getting pills, powerful pharmaceutical psychotropic medications for no reason? Now they're acting weird. 22 years of questioning. It evolved to shouting when I was about 15. Okay? About 15 years ago. Now, we go to some teens report non-medical use of prescription drug disorders. Let's go down to 2006-2007 National Survey on Drug Use and Health in the NSDUH. NSDUH met the criteria for a diagnosis or abuse of dependence on opioid analgesics, which are prescription pain relievers. The teens reported one or more abuse symptoms such as interference with school and home life, exposure to physical danger, and problems with family and friends resulting from non-prescription use of the pain relievers. So they're having problems with their families. The very thing that they're getting sent to the mental hospital for, that these prescription medications are inspiring in them. And it goes on to say, reported symptoms of dependence disorder such as experienced pain reliever tolerance or withdrawal and giving up activities. So they're becoming brain-dead sheep for the New World Order. Go on. 7% of the NSDUH teen respondents reported that they had used prescription painkillers on a non-medical basis during the past 12 months of this group. 7% met diagnostic criteria for abuse and 9% for dependence. Another 20% had symptoms that did not reach the threshold for a diagnosis. The teens who misused the painkillers had done for 56 days on average. Now notice, these tests are similar to my tests. Okay, the results aren't as dramatic, but they didn't go into depth with each patient as I did, and didn't analyze it in depth as I did. Now, we go on to the final article of this video. It talks about facts about prescription drug abuse and addiction. Now, this is important to notice that we are reading this from the National Institute on Drug Abuse. Prescription drugs can help patients manage chronic or severe pain, restore emotional or behavioral balance, control sleep disorder, or fight obesity. When prescription medications are abused, however, the consequences include addiction can be dangerous, even deadly. The newest research report focused on the risks associated with abuse of three classes of commonly abused prescription drugs: opioids, central nervous system depressants, and sedatives and tranquilizers and stimulants. What are opioids and what are the potential consequences of their abuse? Opioids include morphine, codeine, related drugs such as oxycodone, hydrocodone, Vicodin, and meperidine, Demerol, and are commonly prescribed to relieve pain. Opioids can produce drowsiness and, in higher doses, depress respiration. Opioid drugs can also cause euphoria. This is why, in my tests and other people's tests, they're saying they enjoyed their medication. Of course they enjoy it. It's causing euphoria inside of them. Now, this is why I interpreted my results in the first video the way I did. Because I understood the effects, I understood what they're describing, and I gave my professional opinion on how to analyze these results properly, and gave them a number about 60%. But that number was shooting low. But anyway, taken as prescribed, opioids can be used to manage pain effectively without untoward side effects. Chronic use of opioids can result in tolerance, which means that users must take high doses to achieve the same effects. So, higher doses, you know, it's just like any other drug. You buy more and more and more of it until it kills you. Any other painful chemical drug, harmful chemical compound drug. Now, withdrawal symptoms may include restlessness, muscle and bone pain, insomnia, diarrhea, vomiting, cold flashes, goosebumps. So whether they get you on it legally or illegally, you're going to go through withdrawal. You're going to go through the symptoms that are going to make them want to give you it again. It's going to be no problem for you to re-up on your dose once you're going through the symptoms that require someone that allows somebody to get a prescription for it in the first place. Now, what are the CNS depressants and what are potential consequences of their use and abuse? Among the most commonly prescribed CNS depressants are barbiturates such as methylbarbital, Mebarol, and pentobarbital, sodium nembutal, which are prescribed to treat anxiety, tension, and sleep disorders, and benzodiazepines such as diazepam, Valium, and alprazolam, Xanax, which typically are prescribed to treat anxiety, acute stress reactions, and panic attacks. Other benzodiazepines such as triazolam, Halcion, and estalzolam, Prosom, are prescribed for short-term treatment of sleep disorders. So you can get this shit from anything from depressions, which 89% of the population has, sleep disorder, which if you don't have depression, you got sleep disorder, okay? You can get a prescription drug for anything. It's the biggest drug market out there. And there's pushers in everywhere you look. Now, although the various classes of CNS depressants work differently, there are also produce beneficial drowsy or calming effects in individuals suffering from sleep disorders or anxiety. If one of these drugs is used over a long period of time, the body will develop tolerance. Larger doses are needed. Now let's go. It talks about the withdrawal symptoms and the overdoses can be fatal. And let's go on to what are the stimulants and the potential consequences of their use and abuse. Stimulants enhance brain activity, increase alertness, attention, and energy, raising blood pressure and elevating heart rate and respiration. Now, how many people got to take high blood pressure medicines because stimulants they've taken over their life have caused them high blood pressure? It's especially a problem in the African American community. Eugenics, evidence of eugenics, evidence of eugenics, evidence of eugenics. Stimulants such as methylphenidate, Ritalin, and dextroamphetamine, Dexogen, are prescribed for the treatment of narcolepsy, attention deficit hyperactivity disorder, and depression that has not responded to other treatments. They also may be used for short-term treatment of obesity. Individuals may become addicted to the sense of well-being and enhanced energy that stimulants can generate. So they're addicted, they're happy, just like the other things. They're enjoying what's killing them and causing them the cycle of drug abuse. Now, I want people to open up their minds and realize that we are facing a ruthless conspiracy, as President JFK said, that involves guerrillas by night instead of soldiers by day. And I would add on that it involves psychiatrists under the cloak of darkness who operate day or night, night or day, to take your freedoms away. Just like many members of the former administrations of our government said, these people stopped focusing on fascism, started focusing on communism. That allowed for this practice of Nazi, fascist, prescription pill insanity to exist.